Welcome to Research Perch from the Massage Therapy Foundation. Short, practical insights into massage therapy research and how it can benefit your practice.
Hey everyone, welcome back to Research Perch. I'm Michael Reynolds from the Marketing Committee of the Massage Therapy Foundation, and we're glad you're here. Here as always with Ruth Werner and Nikki Mugg. Nikki, how are you?
Hey, doing great. Thanks, Michael.
Excellent. Glad to hear it. Ruth, you doing well?
Of course. How about you?
Excellent.
Yeah, are you sleeping through the night yet, Michael?
Getting there, yes. Our 6-week-old little boy is starting to sleep a little more, so we're only waking up about once or so a night, so it's not too bad, yeah. So he is
That's about what I do with a 4-year-old.
He is awesome. He's a blast. So again, thanks so much everyone for joining us. Research Perch, as you hopefully know, if you're a longtime listener, by now you know we unpack articles from the International Journal of Therapeutic Massage and Bodywork, which is at ijdmb.org. If you're just joining us, welcome. We're glad to have you aboard. We offer this podcast on video on the blog of the Massage Therapy Foundation website, so you can watch it there, or you can listen on the go via your mobile phone through iTunes or Stitcher, and you can listen to the audio podcast on the go, so in the car, at the gym, folding laundry, wherever you might find yourself. So with that, let's go ahead and kick off today's article. So today we're talking about the impact of the Swedish massage. Swedish massage. Let me start that over. The impact of the Swedish massage on the kinesthetic differentiation in healthy individuals. So wow. So let's start with my dumb question, which I always like to start with the dumb question. What is kinesthetic differentiation? Who'd like to take that one?
Well, so I had to do a little looking into this because as I was reading this, I had a perception of what this was and what it is that they were actually measuring. And essentially what it is the ability for somebody to assess their level of force and strength, basically.
Okay.
So
like
that's
grip,
required
right?
to do a particular job.
Right. And so what they do here is they establish what their MVIC is, which is your maximal voluntary isometric contraction. So how much force you can do when you have to do it to the absolute max. And then how well can somebody say, okay, now do 75% of that. Now do 50% of that, and how accurate are they?
And they were studying the hand grip, right? Like they were
so they were
specifically
doing
looking
this
at the hand grip. Okay, got it.
And so they equate this to the importance in athletics. So being able to do that work right when you need to and put forth the right amount of effort to reach a certain goal.
Well, this applies to me because I play tennis, so obviously the grip in the tennis racket would be a factor here, right?
Yeah.
Right.
Or a baseball bat, or throwing a ball, perhaps.
What kind of speed you want to bring to your swing for accuracy? So the theory is this is about efficiency of muscle contraction and accuracy of the movement that you want to make.
Okay, awesome. That makes a lot of sense. That helps.
So
it looks
I'd
like
like to do just a little bit of A&P background on this to kind of get it set up a little bit, because this is actually one of my favorite topics. It's all about proprioceptors. And so when we go to pick up a cup of coffee or a cup of water, Nikki, you want to pick up your bottle of water because you're always good at that, right? We can predict how many, not in numbers in our head, but we can predict what percentage of our muscles it will take, what percentage of fibers it will take to do any particular task. And what helps us sort of monitor that information is our proprioceptors, our Golgi tendon organs, and our muscle spindles, and our muscles and tendons, and in the joint capsules that tell us how fast we're moving, how much resistance there is,
where we are in space.
Stretched muscles are, say on the opposite side of the joint. So the thought here for these researchers is that conceivably Swedish massage might help us be more accurate with interpreting our proprioceptive information as a result of Swedish massage. Because if people are misinterpreting that information, or if their proprioceptors are giving them bad information, then we find things like you're gripping the steering wheel really hard because you think that somehow that's going to make you a better driver. Right? Or if you've seen children when they're learning how to write and they break their crayons because they're gripping it so hard, or people when they're first learning how to do massage And you know that you never want to be someone's first petrissage, because it's not a happy thing, right?
I remember those days.
Right? But as we learn these new skills, we get easier and easier, and we learn how to do them with less pressure and with less effort and less force. There you go. Are you playing with your pencil, or are you playing with your camera?
Both.
You know, and so the theory behind this is that conceivably receiving Swedish massage to a particular muscle group, in this case the hand and forearm, might improve the fine-tuning and the accuracy with which people are doing these grip strength tests.
And being able to determine this is 50%, this is 25%, which is what
Exactly.
they measured here.
Right, right.
Okay, got it. So it looks like they did a study with 30 participants.
Yep.
And, applied Swedish massage, correct?
Well,
and let's talk a little bit about these participants, shall we?
Okay.
Sure. Okay. Yeah.
The term they use is purposively selected, which means basically choose. I want you in my study. I want you in my study. I want you in my study. So these were all young adults in the neighborhood of
20 to 22.
Thank you, 20 to 22. They were all, basically they were all healthy college students.
Right, well, they're in a physical fitness sort of program, right? So they're all,
exactly. Exactly. So it doesn't quote these, or it doesn't label these participants as being athletes, but I think in terms of the general population, we would call them athletic people.
They are fit and most likely to be already good at this. Right?
Already healthy in any case, and yeah.
They were going to be more able to differentiate between how much force they're using, because they do it more and they're probably more active. Yeah.
Right.
So what they did was this was a design that everybody all had the same thing happen. Okay. Mm-hmm. So all 30 of these folks had both of their hands measured. Okay. But only their dominant hand was given the massage treatment. And so what they did first was they did the measurements first. So they got a baseline, of the grip strength. So first they did their dominant hand. They did the 3 trials of max to get the MVIC. Mm-hmm. Yep. And then they were asked to do 50% of that. They did 5 trials of 50%. They did the average with that to find out what the error was. And then they were asked to do 25% or 50% of that, so essentially 25% of their MVIC. They did 5 trials of that, and then they did their non-dominant hand to use as a quote-unquote control or a comparison, okay? And then the dominant hand and forearm was given a standardized 15-minute massage, and then they did the secondary measurements, so the same thing. And so it's also important to note here that they were also inadvertently testing, and I think they talk about it, another thing that is talked about in the massage literature and performance literature, and that is this idea that immediately following massage, performance actually declines. Mm-hmm. And so you go and get a massage, and maybe the muscles are just a little too loosey-goosey, or they're so relaxed that they're not able to perform optimally. There we go. And so they were also able to look at that to see if that max strength shifted before and after massage. And there's conflicting evidence about that in the performance literature. Mm-hmm. So that was the design.
And so the outcome, you want to tell us a little bit about the outcome?
Well, essentially, it's somewhat hard to
yeah, it's hard to convey.
But basically, I think what they were saying is that there's no change.
Yeah, that's kind of what I read from it, and I wouldn't say I'm shocked either hearing what you said previously about the actual decrease in differentiation after massage. I mean, if I were to get a Swedish massage and then go play tennis, like my arm would be kind of relaxed, and I'm not shocked by this finding, I guess is what I'm saying.
Well, actually, what they find with that in regards to that is that there isn't a change in the max.
No change at all.
Okay. Yeah, there wasn't a change actually. So that this expected decrease or this proposed decrease that happens didn't happen in this group. Mm-hmm. And so does this negate the other findings? Not necessarily. They also find their conclusions state that there was no change in from the massage in the kinesthetic differentiation.
in the ability to determine whether they were at 50% of their strength or 25% of their strength.
Right. So it didn't get better and it didn't get worse in that dominant arm that was receiving the massage. And one of the things that I have trouble with, not necessarily just this study, but with other studies who have done this performance type assessment for massage, that there's an inherent ceiling effect that is happening with their population that they're doing the study in.
I'm sorry, an inherent which?
Oh shoot, what was the word that I used?
Something ceiling effect?
You said ceiling.
Oh, ceiling effect. Yeah, an inherent ceiling effect. Yeah.
As in ceiling above your head?
So, right. And so if somebody is, so for those of you who are looking at the podcast, if you have somebody that's functioning here, but the most optimal functioning is way up here, there's an area to move to get better. But if you have somebody that's already performing at a pretty optimal level, and so these are healthy young people who are in a physical education program, so they very well may even do these sorts of tests often. I don't know.
Right.
But then you're going to do this grip strength and this proprioception piece, kinesthetic differentiation. Aren't they already doing this pretty gosh darn well? And are the potentially subtle massage effects that you're going to get from a 15-minute session already on a dominant arm? An arm that is already conceivably better than a non-dominant arm, which they were comparing it to. What is there room to get better?
Yeah, that's a good point. I mean, do you feel like? Yeah, go ahead, Nikki. I'm sorry.
I would actually propose that you would want to do a study like this with very diverse ages. So get these folks who are young, and then go and get some 50 and 60-year-olds. That you've got a 40-year difference now, and so this is the gerontologist in me talking, and then see if there's some shit, or heck, do it with somebody who has problems and established problems with this kinesthetic differentiation. So populations that do have issue, that there is room to improve, and then see if this massage protocol is beneficial. So to say that massage in this regard isn't going to be beneficial, to say
is leaping to a bigger conclusion that I think is probably valuable. I'd like to add some more things to that, because I looked briefly at their massage protocol, and it was a standard sort of, it was an established, they had a trademark name, but it was a Polish name, so I don't think we'd recognize it, but it didn't look like anything unusual. But if what they're looking for is proprioceptive accuracy, what I would have proposed as a massage therapist would be to do some types of massage on that hand and forearm that challenge proprioceptors. You know, and even just basic PNF, proprioceptive neuromuscular facilitation moves, where you're having people contract against resistance and then stretch, can really change the way we engage with our muscles. At least, we know that from empirical reports, and that does not seem to be the kind of massage that they did in this little 15-minute hand and forearm treatment. So I'd be really interested in that. The other thing I want to bring in this is that it's, their concluding sentence essentially was that massage therapy does not affect the kinesthetic differentiation and can be safely used before athletic activities that demand precision. And I would really challenge this. Just from having been on the scene at a number of sporting events, I remember once I was working pre-massage at a ski jump trial in Utah, and I'll tell you what, every single skier who got a pre-event massage that included stretching biffed it. Every single one did not make the jump.
Yep, because it throws them off.
Yeah.
Yeah.
Interesting.
Yeah, so it's a very interesting how they're applying this and how some of the conclusions that they're drawing from this. Yeah, but for this population and what they were testing, there weren't changes, and I think that's a really important thing to highlight here. Is this is very much of an efficacy type situation. It's not necessarily doing massage therapy for improvement in kinesthetic differentiation, and in a population where that would be important. So, but for a conclusion to say that, okay, based on this, it is okay to do these sorts of pieces because it doesn't decrease strength and it doesn't decrease performance necessarily, I'm not so sure about that.
Yeah.
across the board. This is a one task piece, and it doesn't have. There's a precision for effort and force here, but it's not precision in, say, fine motor skills that might be needed for something else.
That's another thing. Yeah, this is all completely static, and they made that point. This was a static test, not a test in movement.
Yeah, they do. So there are certainly some valuable pieces to pull from this. I think one of the interesting things that it does too is it broadens, from the international journal perspective, it really does sort of broaden the view of how massage therapy is applied in other contexts. These are physiotherapists, which and correct me if I'm wrong here, Ruth, that it's more aligned with what we would consider physical therapy here in the States, or no?
I think that there's less reliance on machinery.
Oh, okay.
I think my understanding is that physiotherapy in Europe involves some machinery, but it is much more a manual therapy than we see in the U.S., where PT is much more, sort of machine and exercise based.
Okay, but the training and things like that is more at the level of physical therapist here than massage therapist, or?
Boy, you got me. I couldn't speak to the training level.
I don't know.
This is just what I know.
Because I see physiotherapists, and I think more in the lines of physical therapist who does a lot of soft tissue mobilization type things, manual therapy. So.
Yeah, that's probably a reasonably accurate thing, but again, we're speaking out of educated guesses here.
Right. But I think it's a really nice thing that we're seeing these from, this is an international journal, the International Journal of Therapeutic Massage and Bodywork is, and here is an example of an international contribution coming, and even pulling in references, Polish references, that while we may not be able to read them, I don't read Polish, but it does sort of speak to that broader audience, which is really nice.
Well, and the other thing that this paper did that I really appreciated is, we don't get a lot of papers on improved sports performance. We don't get a lot of papers on working with healthy people. It
surprises me.
Yeah. We get mostly papers about working with people who are struggling with some health issue, which is wonderful. But it's, there's a whole other branch of massage therapy that we see less research on, and reading this paper made me really curious to dig into some of their resources, even though they're in Polish, and I don't know that I'll ever be able to do that. But there's a whole body of research about massage for fitness and for sports performance that, is probably mostly untapped in the United States, and that's an exciting prospect.
Yeah, well, hopefully we'll see more research in that area.
Yeah, I hope so too.
Well, great discussion, both of you. Thank you. And since you did mention the IJTMB, just another kind of shout out to our audience to remind them that these articles do come from the International Journal of Therapeutic Massage and Bodywork, and that's at ijtmb.org. And we always encourage you after the podcast, or before, or whenever actually, to go find the article, download the whole thing, read it, kind of digest the content that we've discussed, and I think you'll find it very interesting and very helpful in your practice. So again, that's ijtmb.org, and that's a free resource. Please subscribe.
Right, and please do be sure to register for the IJTMB so that you'll get a quarterly notice when the new editions come out.
Yeah, subscribe for free, and you'll get those notifications. Thank you, Ruth. All right. Well, Ruth and Nikki, thank you so much, as always. Great discussion. And thanks, everyone, for our listeners and our viewers for joining us today. We appreciate you supporting the Massage Therapy Foundation and Research Perch podcast. So thanks again to you both, and thanks to our listeners. We'll see you next time.
Thanks, you guys.
Thank you for joining us for this episode of Research Perch. Please send feedback or questions to perch@massagetherapyfoundation.org. See you next time.